Hello, the following is a video tour of the Spokane Psychology Doctoral Internship at the Mann-Grandstaff VA Medical Center in Spokane, Washington. The Spokane Psychology Doctoral Internship is an APA-accredited 1-year, 2,080-hour internship offering comprehensive generalist training in professional psychology based on the practitioner-scholar model. The Spokane VA Medical Center offers healthcare in a variety of settings, including primary care, surgical, behavioral health, long-term care, physical therapy, audiology, and dental services. Predoctoral interns are employed within Behavioral Health Services, or the BHS, which has traditionally comprised 14 full-time psychologists, including the Behavioral Health Service Chief. The Spokane VA MC employs a total of 95 full-time behavioral health employees. Interns will spend 1 year and 60% of their time in the office in the General Mental Health Clinic, which involves outpatient consultation, assessment, and psychotherapy. Interns' remaining time will be spent in 2 6-month rotations. The interns choose from a variety of minor rotations for the remainder of their training and can participate in up to 4 minor rotations for 6 months each. The minor rotation options include Community Living Center, or the CLC, Primary Care Mental Health Integration, PCMHI, Substance Abuse Treatment Program, SATP, the PTSD Clinical Team, or PCT, Neuropsychology Assessment, and Acute Psychiatric Unit. The video is currently walking through GMH. Within GMH, interns gain experience treating an array of mental health disorders as a clinical team member in the outpatient mental health treatment clinic. This clinic serves urban and rurally located veterans in the Spokane area, as well as veterans from across the region referred for psychiatric treatment. Primary duties include clinical intakes, individual or group therapy, assessment, interdisciplinary treatment team planning, patient feedback, and possibly couples therapy if interested. Interns participate in weekly multidisciplinary team meetings, presenting cases and conducting treatment planning. Interns receive training and supervision using evidence-based interventions with a broad range of psychological disorders and symptom severity. These rooms are where you'll be spending much of your time treating, providing group therapy, or experiencing didactics. The following are some offices that interns may use for individual or psychotherapy services. The PCT and SATP rotations have traditionally been housed within BHS as well, within Building 40. Interns on the PCT rotation will work with veterans diagnosed with PTSD, presenting with a wide variety of clinical presentations and traumatic experiences, particularly combat and military sexual trauma. Within SATP, interns will focus on providing psychological services to veterans with substance abuse and co-occurring disorders in an intensive outpatient setting. The rotation will include opportunities for individual and group psychotherapy and give you the opportunity to be part of interdisciplinary team meetings. The neuropsychology rotation will also be housed within these offices. Primary care mental health integration provides interns with the opportunity to experience how psychologists function when embedded directly in a primary care setting. The short-term, problem-focused approach that defines this area will be taught, as well as how to work closely with physicians, nurses, and other associated professionals to provide quick access to veterans in need of health-related interventions. Short-term interventions focused on depression or stress management, adherence to medical advice, coping with health-related anxiety, and evidence-based treatment for insomnia are all taught as part of this rotation. In addition to these experiences, motivational interviewing techniques focused on helping patients change unhealthy behaviors are emphasized. The following images are of the physical therapy area and CLC garden for the Community Living Center rotation. This is a short-term residential care inpatient rehabilitation service, and also it offers hospice care in a 38-bed facility. Interns engage in interdisciplinary care with a variety of other professionals while providing veterans with consultation and therapy services. To ensure veteran safety and confidentiality, we were only able to provide video of the garden and physical rehabilitation area. The following will be images of the APU, or Acute Psychiatric Unit, entryway. The unit is currently under construction and expected to be done late 2021. This rotation will allow interns to work with veterans requiring inpatient psychiatric services and provide individual or group therapy. These are images of the cafeteria and commissary stores. The following are images of the on-campus chapel. My personal favorite is walking out to see the beautiful pine forest as I head out for the day. So that concludes our tour of the Mann-Grandstaff VA Medical Center and the internship. Should you desire more information, please consult the internship handbook or contact the training director with questions.